Hello, my name is Tainijoki. I'm the Senior Medical Advisor of the World Medical Association. WMA is the international representing body of all physicians. We have 150 national medical associations, and we act on behalf of patients and physicians. And WMA enables to achieve the highest possible standards of medical care, ethics, education, and health-related human rights for all people. WMA is an organization, we do a lot on policies, and we have a policy on immunization where we try to increase the awareness and where we act physicians, national medical associations, and governments act on certain topics. Immunization can prevent approximately 2.5 million deaths each year. So it has a quite big impact, so sometimes far better than any medication. The aim of immunization is the total eradication of communicable diseases. We achieved this for smallpox, and there was an aim to do this for polio. But now with a new global international situation, that aim is quite difficult to achieve, which is a big pity. So to achieve immunization, we need to have an environment in the health system which is resourced with appropriate materials and health personnel. So that's why we ask governments to commit resources to immunization programs and have national vaccination targets and equip the health professionals with this, either to have the vaccination and fridges and everything what is important, but as well comprehensive training and communication training, and give them as well the time to address this topic with the patients and have their more education time as well for patients, why immunization is important. Another aspect is to focus on vulnerable populations at risks. And last but not least is the support of vaccine research and development. Of course, immunization is important because there are links between communicable diseases and non-communicable diseases, and immunization would help the overall health of the society. And when I was a young physician, I only learned about immunization in children. So the awareness among physicians and the society, the patients, is not very high for adult immunization. So that's why I think the advocacy for lifelong immunization is very important. And if you see the aging population and the elderly people have often comorbidities, where it is especially important for them to be protected, to be supported in their immune system for all their comorbidities. So that's why long life immunization is important. We still have things to do for child immunization globally. In richer countries, in high-income countries, child immunization programs are quite established. But even there, we see in the US now the hesitancy of measles vaccination, and already children are dying of this. But in low-income countries, immunization in general needs to be improved, and there as well adult vaccination. It's not only important for infectious diseases, it's as well important for non-communicable diseases, because, for example, someone who has a heart disease might have a higher risk of getting the flu, or someone who has a flu gets as an outcome, as a adverse effect, heart issues or lung issues. And the same, we know it for many others, like tuberculosis, are links between non-communicable and infectious diseases. But immunization is not only important for this, it has an impact on the antimicrobial resistance. And it's seen as a measure against antimicrobial resistance. And when we think about the One Health approach, their immunization is very important as well. And here we need to think not only of immunization in human beings, immunization of animals as well. So WMA hopes through this initiative to really increase the awareness among physicians and patients on the importance of immunization, and there especially the lifelong immunization. And we would like to increase the awareness among governments as well, the importance of this and the return on investment, and have an enabling environment, which means We need to have a health workforce which is educated and equipped. The health workforce would need to have more training, especially communication training, and needs as well the time, because in an ideal world, if a patient comes to a physician, maybe an elderly patient, it would be good to regularly check the immunization status, or in Northern Hemisphere in autumn, in Southern Hemisphere in springtime, to address these issues and explain to the patients why it is important. Then we see after COVID, the increased vaccine hesitancy. There's still a lot to do. So physicians and other health professionals, we need to be equipped and trained to do this. And with a global shortage of physicians, or health professionals in general, where the time health professionals can spend with patients is getting shorter and shorter, the pressure is higher, burnout is quite high among health professionals. There's not so much space and time to address these issues with the patients. So therefore, we would like to increase awareness among governments on the importance of investing in the system and in immunization programs.